This is another edition in our ongoing series on critical issues in healthcare. I'm Darren Dopp, and today I'm talking to the author of a new report on driving trends in healthcare. My guest is Courtney Burke, Chief Operating and Innovation Officer at HANYS. Thanks for joining us, Courtney.
Thank you. Nice to be here.
Courtney, how do you define a driving trend?
Well, a driving trend is something that is observable. Sometimes that can be something that you see happening over time, but it is best if you can define it with data points, and it will be heading in a certain direction. So a driving trend is one that is very important, may be affecting other trends that are happening in the healthcare marketplace. So in terms of how did we use trends to do our work, we did some research. We used a lot of the expertise here at HANYS, various staff who are experts in given areas. So we all sat together, we said, what are these trends that are most important, and which ones should we be looking at? At the same time that we were all talking and doing research and looking for data points here internally at HANYS, we interviewed CEOs from across the state and asked them what they saw as the most important driving trends in healthcare, and what did they see would continue into the future. And that's how we decided on what would be the most important trends to highlight in our document.
What process did you follow to identify these trends?
We identified close to 20 trends, and you could put them into big categories. The first among them were some of the financial trends that we're seeing that are happening in the healthcare industry. But a lot of those trends are driven by demographic factors. So the aging of the population becoming more diverse, and then looking at how those trends impact funding for public programs like Medicaid and Medicare that fund a lot of what's happening in the healthcare system. But we also looked at advancements that are happening. So was technology disrupting the marketplace? What was happening in terms of consolidation, both between providers as well as vertical consolidation among insurers and other entities that have not traditionally been part of the healthcare system, like a CVS and an Aetna working together. But then we went further and we looked at what was happening in things like artificial intelligence. How is the workforce changing, for example, now that there's more of what's called a gig economy, where people want to work more on their own hours. And then lastly, what I would call consumerism, and how the desire for consumers to have things more quickly, more conveniently, is impacting healthcare.
What are the most important 2 or 3 trends in your mind?
I think the trends that probably have the most impact, first is just the demographics, because it's driving so much and it's not something that is controllable. And with the aging of the population, there will definitely be an impact on the healthcare system. I think secondly would be technological advancements and the pace of that technological advancement, which is also impacting how consumers are viewing healthcare and how they expect to get their healthcare. So I think that's also driving a lot of what you're seeing happen. And then lastly, I would say the consolidation, particularly among insurers. If you think about the 5 biggest insurers in the country, Aetna, Anthem, Cigna, Humana, and United, those 5 alone account for 51% of the population that's covered by insurance. So that consolidation is driving a lot of what's happening in terms of their market power and how providers can survive or react to those other players in the marketplace.
Courtney, so much is happening in healthcare. Is it really possible to make sense of it all?
Well, there is so much happening in healthcare every day, and part of the reason we went through this planning process was because you want to know of the things that you read on any given day about new technological advancements, mergers that are happening. You want to know which are the most important to you as a healthcare provider. And so we wanted to help our membership be able to discern what they should be paying attention to. And that's why we worked with our board to identify those important trends and think about how that might impact the future.
Are you optimistic about the ability of healthcare providers to adjust and adapt to everything that's occurring?
I'm very optimistic that healthcare providers have the ability to adapt to the different trends that they're facing in healthcare. But first, you have to understand what you need to adapt to. And that's part of why they were very excited to go through this process with us, of looking at these various trends and determining which ones were probably the most uncertain or the most impactful and would continue in the future, so that they could prepare strategies to be more resilient.
What are your next steps?
We want to make sure that the entire healthcare industry is aware of the research that we did. It will hopefully help them in their decision making. But we also want to work actively with providers across New York State to look at the different ways that they can be resilient in the future. And they helped us identify 4 ways that they want to be resilient. One was to control more of the dollar, given the fiscal pressures that they have. Second was to understand consumers so that they're developing technologies and processes and services that a consumer would like. Third would be embracing technology. Instead of fearing what Google and Amazon and Apple and Microsoft are doing, how do you partner with companies like that to better serve the consumer of healthcare? And lastly, how do you innovate around workforce? Because workforce is so important in the care that people receive, and they need to be able to adapt to the different changes that are happening in healthcare as well.
Thanks so much for being here today and talking to us about this, Courtney. And thank you for watching. Please tune in again for more discussions of critical issues in healthcare.